Why is autonomy important in healthcare, and how can it benefit the patient? As a medical provider, if we act ethically and respect the autonomy of others, they can make true decisions. Sometimes we are so task oriented that we forget to see the patient in a holistic view, mind, body, a patient overall, and do not provide the best advocacy for them to make the right decision. I recently had a patient who had real bad cellulitis on one leg and was just diagnosed with diabetes as well. This patient did not want to be admitted. He was giving a lot of pushback. So I sat down and talked to him. I built that rapport with him. I translated for him. I explained the situation and how it was very important for him to receive IV antibiotics instead of oral antibiotics because he was a new onset diabetic. And he opened up to me and said, you know what, I am a gardener. I'm working on my green card. I don't want this admission to affect my immigration status. I'm not sure how much is this going to cost me. And I explained to him there are many external factors that may prevent you from getting admitted today. I'm like, there are multiple programs we provide. There's emergency medical. There's things that we could provide to you for free, but you need to get better. And he agreed to stay, and I provided outside information, diabetic classes for the future, and he was very grateful. And he actually thanked me because he says deep inside he wanted to be admitted and get better to continue working, but he did not make his full decision at the time based on the knowledge he received in the beginning. He says, all they told me is that I had really bad infection, and if I don't get admitted, I could lose my leg. And they never talk about financial. Then I was like, well, we're not allowed to talk about financial stuff in the ER. That's intolerable violation. But I want you to ask me all the questions you have so you can make the right decision. And that helped alleviate the stress. And he was actually glad towards the end when the financial person came and explained to him that it was going to be covered as an emergency stay. And he was very grateful, and it changed my life. And how external factors and stressors can affect decisions of other patients if they're not given the right direction, the time to sit down and explain to them for them to fully understand what's going on.